Hi everyone, my name is Caitlin. Here's a little bit about me. So, I currently work two nursing jobs. My first job, I work at a level one trauma center in Worcester, Massachusetts, UMass Memorial. I work on the neurotrauma unit. So, it's a lot of strokes, seizures, brain injuries, neurosurgery, general traumas, some ortho as well, and then some mental health disorders, as well as like dementia, Alzheimer's diseases like that. My other job is on the other end of the spectrum where I work outpatient at a medical spa. So it's a lot of injections, cosmetic procedures, lasers, vitamin infusions, vitamin injections, um, wellness, all of those things. So my clinical experience is mostly in adult populations. I don't have much pediatric experience. But for the most part, I'd say the age range of the patients that I've worked with is like 30s to 90s. I do have a lot of experience with assessments and sitting with patients one on one from the medical spa job, and then kind of more experience with time management and crazy patient load from working on the medical surge aspect of healthcare. I'm from Westminster, Massachusetts. It's a little town in Massachusetts. One of the main things there is Wachusett Mountain. There's a lot of nice hiking trails, things like that. So I'm in the Eastern time zone. Some hobbies, I really enjoy just moving my body, getting outside. I do CrossFit. I like hiking. Like I said, there's a lot of good trails around me, as well as in the winter, a lot of good like skiing trails. And then we're a hockey family, so I do enjoy in the winter going to my husband's men's league games and then just going to like the local tavern after and hanging out with everybody on the Sundays. A little bit about me. Last semester on July 26th, I had my son Lucas. So he's about 5 weeks old right now. So here's some pictures of him. One thing about me that not many people know is my first job that I worked for years when I was in college. In high school, I was a kickboxing instructor. So that's just a little fun fact. The NP concentration I chose was the FNP route. I chose that because I work on the stroke unit and I see a lot of people have debilitating strokes that often could have been prevented by seeing a primary care provider. Because you don't just have a stroke, it often has comorbidities like high blood pressure, diabetes, things that were not controlled that could have been controlled and helped prevent some of this. And I see the major lack in primary care in the hospital all the time. And then on the other end, already having working outpatient and being able to sit one on one with patients and kind of building a relationship with them through multiple appointments, I just really liked that aspect of family care and being able to see patients throughout their lifetime. Some self-care or complementary therapies I already practice. Like I said, I work at a med spa, so a lot of vitamin infusions, a lot of vitamin shots, red light therapy, NAD, all of that. I'm very fortunate that I do get to have access to some of these newer therapies and newer anti-aging um, modalities. That's kind of why I took this course because it kind of goes hand in hand a little bit, and I was very interested. Some questions I have for the faculty, I guess, would more be like what certifications can you take for complementary therapy practices, as well as like what careers are there in this field of nursing. I feel like it's not really talked that much about. In that I know you can take like the holistic nursing certification, but how do you go about using that really in your career unless it's just like addition to your normal practice and kind of just using what you learned if there's any jobs that are like just for complementary therapy.